Welcome, Dr. Hidayat Khan. It's an honor to have you with us on a VOH platform and the MFI event.
Thank you so much for giving me this opportunity. And as we have already done a session today, and medical tourism is a very vast subject. But being in India, I would like to more focus upon domestic medical tourism. You know that 80% of the patients who travel from tier 3, tier 4 cities to tier 1 city or tier 2 city for the better healthcare. So we are the one who will make that, who will fill that gap, how to transfer the critically ill patient or patient who cannot travel by themselves. Usually there are two types, one is elective, another one is emergency. So we come in picture for emergency medical evacuation. Patients who are on ventilator, patients who are on intra-aortic balloon pump, patients who are on pacemaker, patients who are on multi-organ failure, patients who are on ARDS with acute kidney injury. So such kind of patient we will be able to transfer, and we will be able to save lots of patients' life. So there we would like to develop one mechanism. So there should be one single click away from the needy patients, and that way we can add more value to the domestic medical tourism. Now rest we will talk about international medical tourism. Here in India, all big hospitals cater the international medical tourism, but the most of them are elective. Again, we come in picture for international medical tourism. Whenever there is whenever there is a transfer for critically ill patient in the emergency medical tourism, we come in picture. If we talk about 100 patients who comes in a category of emergency medical tourism, the 80% won't even come. Only 20% will come because they can afford and they know how to bring the patient who are terminally sick from one country to another country or one city to another city. So in such conditions, we are well skilled and expert to travel such kind of a patient with the Sky ICCU facility. Yesterday we shifted one very critically ill patient for a very top class corporate from Vietnam to Mumbai. That patient is a 49-year-old, had a vehicular accident and had a multiple contusion, and patient was on ventilator. In conscious level, we grade GCS, Glasgow Coma Scale, that was just 6 to 7. We transferred that patient from Vietnam to Mumbai. There was a refueling halt in Bhubaneswar. It was a multi-doctor decision and I was leading it, and we could do that evacuation successfully. So such type of work Human Care Worldwide is doing. So Human Care Worldwide is basically a one-stop medical assistance. What I am talking to you about air medical evacuation, that is only the one segment. We talk about human care is a one-stop medical solution. One is air medical evacuation. The repatriation itself comes with a different categories. Air medical evacuation is a two types. One is emergency, another one is elective. Emergency mein you have to do a charter flight, though that is very expensive and everyone cannot afford it. Then we do it in a commercial airlines as a stretcher case with Sky ICU facility with the patients on ventilator also. So that will reduce the cost almost 70%. Third, we have a train ambulance. No one must have heard about train ambulance. Yeah. The Indian patients who are from Northeast and they want to come to Delhi, Chennai, Mumbai, Delhi, Hyderabad, they cannot afford a 15 lakhs, 20 lakhs because their budget is 10 lakhs rupees. We transfer them in train with medical escort and oxygen from that city to another city. Then that is another in via road. Third one is to reduce the cost in commercial airlines as a stretcher as well as business class. If business class is not possible, we can even do that as an economy in 6,000, 8,000 rupees seat. So that way we can add value to medical tourism in domestic, and same thing applicable for international also. The second important thing, we have a pre and post hospital care. We will talk about post hospital care. When the patient is admitted, we have dropped the patient now about post hospital care. There are lots of patients, particularly a neuro, land up in long-term neuro rehab. They require nurse, they require bed, they require oxygen at home, and people struggle a lot for all this. So we are one-stop solution. So whenever they come across with any kind of a thing, we are just one phone call away. We have a 24/7 alarm center. Everything will be taken care by us. So that is again a value-added services we have. Third thing, if something goes wrong with the patient is already connected. Usually anything goes wrong, they search the multiple vendor. If they, unfortunately, if they die, if they have taken a last breath there, we are the one who will take care of everything of them. So that called as mortal remain repatriation. In mortal remains, there are domestic as well as international. Again, there are two types, in a private charter as well as commercial cargo.
And I think there's a lot more process involved, and I can get that, we all can get that, how much effort does it go, because more to and fro coordination, that is the key aspect of that. But thank you so much. We got a great aspect on medical value of tourism in India. That's and all because of Dr. Hidayat Khan with us. Thank you so much for sharing this insights. Thanks a lot.
Bye-bye.